Morning Nevada. Today we are covering healthcare. Our first topic of the day is the Affordable Care Act. The Affordable Care Act is amazing because it puts consumers back in charge of their healthcare. As of now, health plans cannot deny or limit healthcare to those under 19 years old. Also, if a person is under 26 years old, they may be eligible to be covered through their parents' healthcare. Another addition to the Affordable Care Act is that if someone makes an honest mistake, their health care cannot be taken away. One of the most important additions is that anyone has the right to ask that their plan may reconsider its denial. As of now, there are also no lifetime limits, banishes on unreasonable increases in rates, and rules to make sure all premium dollars are used on healthcare. Since the healthcare plan has now been approved, we will go to Zoe to see her exclusive interview with President Barack Obama to see his response to this new healthcare plan.
Sophie, hello everyone. I'm here today with our president to find out his response to our new healthcare plan. Hello, Mr. President.
Hi, Zoe. How are you today?
I am great. Thank you for asking. So after the Supreme Court decided that your signature on healthcare law was constitutional, how did you feel?
I was overjoyed. I feel that it was a victory for people all over this country. The highest court in the land has now spoken. We will continue to implement this law.
So, what pushed you to implement this law?
It should be pretty clear that I didn't do this because it's good politics. I did it because it's good for the country.
Wow, that's great. What would you say is one of the most important parts of the plan?
Probably the included provision that citizens who can afford health care should take the opportunity to do so.
Great. Thank you so much, Mr. President. Back to you, Sophie.
Zoe, now we will dive into speaking about Medicaid. Medicaid is a social health program that helps families and individuals with low income and low resources. Through Medicaid, medical bills are paid through federal, state, and local tax funds. It pays low-income individuals of every age and ensures no one pays any part of the cost for medical expenses that should be covered. The deadline to sign up for Medicaid was March 31st. Since March, the number of people who signed up for Medicaid has increased. In the last weeks of the enrollment period, the people who signed up more than doubled. The number of people who signed up after March 31st were 47% of the people who signed up for Medicaid. Out of the 3.8 million people who have access to their racial identity, 63% were white, 17% were black, 11% Hispanic, and 8% Asian. One of the 8 million who bought insurance on the federal or state exchange, 28% were 18 to 34. Women accounted for 54% of the people who selected plans on the exchanges. Now we will go to Zoe for an interview with a woman who signed up for healthcare after the deadline.
Thank you, Sophie. I am here with Alice, who had difficulty signing up for healthcare, so her residential state of Nevada extended her deadline. Alice, how long has your deadline been extended?
The extended deadline for enrolling in health coverage ended in the middle of April. However, I had a lot of difficulties with the enrollment process, so Nevada extended their deadlines until May 30th. Administration has been very flexible with people who needed extra time. Therefore, I'm sure it resulted in higher enrollment numbers.
Actually, the extended deadline increased the number of people to about 1 million. Alice, living in an area with low-income families, have you found people more reluctant to sign up?
According to a new poll, about a third of those uninsured said they wanted to sign up, but it was too expensive. About 7% of these people said they would rather pay the fine than pay for insurance. Most of my neighbors have this view because the fine is very cheap when compared to insurance.
Wow. Thank you so much, Alice. This has been an absolutely wonderful interview. Back to you, Sophie.
Zoe, well folks, this is the end of our newscast. Thank you for watching and stay tuned for next week for a debate about gay rights.
What are you doing?